Hi, what's up, everybody? Hey, how are you doing? Welcome to Leaders Online. I'm Brandon Gingelbach at the Fort Worth Chamber. We're so pumped to have you here on a beautiful Thursday afternoon. We're here to talk about steroids in Major League Baseball. I'm kidding. We're not. This is about COVID compliance. We're so thankful for Higginbotham that's sponsoring today. We're going to talk about COVID compliance guidelines for moving forward safely with herd immunity coming online and getting businesses sort of back in full swing. There's all sorts of questions about employees back in the office, managing and changing mandates, those types of things. So we have an expert with us, Ross Carmichael. Ross is the former U.S. Department of Labor investigator who helps more than 4,000 employees with benefit plans at Higginbotham interpret and comply with healthcare and employment legislation. He received the Secretary of Labor's Exceptional Achievement Award for his work on the Health Disclosure and Claims Issues Project, and he appeared in the Fort Worth Business Press list of 40 under 40 and top attorneys. He's a member of the American Bar Association, State Bar of Texas, Tarrant County Bar Association, and Tarrant County Young Lawyers Association. So Ross is the expert here to help guide us through all of these things. He, if you don't know, is a famous baseball player from Richardson, Texas. We were just talking about his athletic accomplishments back in the great year of 1996, the glory days. So Ross, hey man, thanks so much for joining us. We're thankful that you're here. I'm going to step out and let you take over, and I think you're going to wrap up and close this as well. So thanks so much, everybody, for joining us. Ross, I hand it over to you, buddy. Thanks.
Thanks a lot, Brandon. Glad to be here. Thank you all for having me. I wouldn't go so far as say the expert, because I don't think anybody can be an expert on all this stuff because it's way too confusing and there's way too much going on and way too many moving parts. But I will try to wade through it as best we can. Again, happy to answer any questions along the way. So with that being said, I guess let's go ahead and get started. So hopefully everybody can see the screen. I mean, basically, we're going to be talking about some compliance issues. A good chunk of what we're going to be talking about is essentially the vaccine, mask mandates, et cetera, kind of figure out where we need to be going from here and what employers need to be thinking about. Obviously, one of the big things that we'll be talking about is vaccines, but got to give the disclaimer. I'm an attorney. I'm not your attorney. So none of this is legal advice, not a lawyer-client relationship, yada, yada, yada. We all are familiar with the disclaimers. So just really quickly, we're going to talk what's the latest on vaccines. Can I make vaccines mandatory for my employees, my workforce? And then what else should we be thinking about when reopening, mask policies, social distancing, et cetera? So obviously on the vaccine, unless you've been living underground, vaccines have been approved for use in the United States. Right now, there are 4 main manufacturers, Pfizer, Moderna, AstraZeneca, Johnson & Johnson. The Pfizer, Moderna, and Johnson & Johnson are the only ones approved in the United States. And the Johnson & Johnson, as we've seen, is the first one-dose vaccine. And just if you were wondering, any of you that sponsor group health plans for your employees, yes, right now the federal government is paying for all the vaccines, but should we get to a point where they stop paying for that, under the CARES Act, it's considered preventive care. So any of you all that sponsor group health plans, if we do get to that point, your health plan would still have to cover these vaccines with no cost sharing. Down below, you can kind of see how we got to where we are. There have been over 50 vaccines that basically went into the testing protocol. 35 made it through expanded safety trials. 23 made it to efficacy tests. And then basically where we are is you'll see 8 approved. Now, I know above I say kind of 4 main manufacturers. The reason we say 8 approved is that's actually worldwide. So there are some vaccines in China and some vaccines in Russia that obviously are not here in the US. They've been approved in their locations, but worldwide, we are up to currently 8 approved vaccines worldwide. So quickly, I mean, again, we're all pretty familiar with this. How do the vaccines get distributed to actual individuals? It starts with CDC, and then it works its way down to local, state health departments through public health, healthcare organizations, hospitals, et cetera. So that was kind of the first phase. We all saw that. It was going through hospitals. It was going through the federal government, and the military was setting up huge vaccination stations. And now we're starting to get to what we call the secondary distribution phase, which is clinics, mobile vaccination sites, pharmacies being able to come in, and you being able to go into a pharmacy and have your vaccine. And we're starting to see now vaccines be offered in the workplace. So we are starting to see some smaller pharmacies or even larger ones like CVS offer on-site vaccination clinics, et cetera. And again, where are we as far as who's eligible to take the vaccine? Originally, the CDC had proposed a phased distribution. So we saw, phase 1A, phase 1B were frontline workers, and then we moved it to essential workers and people over the age of 65 or people under the age of 65 with comorbidities. Basically, where we are now in Texas, everybody's eligible. All adults are eligible regardless of age. And the president actually came out earlier this week, late last week, early this week, and said, as of April 19th, I want all states to make the vaccine available to all adults, regardless of age. So again, the CDC, et cetera, they give out recommendations, but who is actually, because vaccinations are controlled on a state level, it's actually controlled on a state by state level. Even though the president has said, I would like all the states to make it available by April 19th, it won't necessarily happen. This was, basically as of last week where we were on a federal level with each individual state about when they will allow all adults to have vaccines. So as you can see, Texas is already covered. So are most of the surrounding states. I have a feeling now that the president has said he would like everybody to be vaccinated by April 19th or be eligible to be vaccinated by April 19th. You'll see kind of all the other states start to fall in line as well, unless something changes. So one of the questions we've been hearing a lot is, can we make vaccines mandatory for our employees? And, the lawyerly answer is yes, but. The short answer, yes, you can make vaccines mandatory, but there are several issues at play around the ADA, Title VII, OSHA, union contracts, state, local laws, and then potential just liability issues that would come naturally with offering or mandating vaccinations of your employees. So the first issue at play is kind of the ADA. So the EEOC has already come out and said this would not be considered a medical examination unless you include pre-screening questions. And those pre-screening questions are because the reason this is not a medical examination is because it's job related, justified by a direct threat, and consistent with business necessity. So for example, lots of hospitals require mumps, MMR, measles vaccines, hepatitis vaccines. So that's why, again, those hospitals can do that. And it's not considered a medical examination under the EEOC because there is a job necessity. All the guidance on this was issued during the H1N1 swine flu pandemic. And basically under that kind of pandemic preparedness in the workplace guidance, they basically said that mandatory vaccines are permissible absent a state or local law to the contrary, provided that an employer can accommodate an employee's disability or medical condition as required by the ADA. So the EEOC right now recommends that employers encourage employees to vaccinate rather than requiring it. And obviously that's still kind of a moving target and we should expect future guidance. But under the ADA, you can require vaccines because it's not going to violate the ADA. Again, unless you ask some pre-screening questions, if you were to mandate it and say, can you take it? And somebody says no, and then you ask, well, why can't you take it? What's your medical history? That could venture into medical examination territory. So that gets into that line previously about an employer accommodates an employee's disability or medical condition. So what that means is that if somebody has a legitimate ADA covered disability that prevents them from safely taking a vaccine, you need to make a reasonable accommodation. So an employer can actually request medical documentation that you have the ADA covered disability. And if the employee provides that, you would then need to provide alternative accommodations such as remote work, providing extra PPE, putting them in an individual office, et cetera. And that would basically involve using the ADA's interactive process for reasonable accommodations. When you get into making reasonable accommodations for your employees, a reasonable accommodation would not be required if it creates an undue hardship on the employer or possesses a direct threat to other employees. So you don't have to make a reasonable accommodation if there is an undue hardship, but that's a very stringent standard to meet. And what that normally means is that there would be substantial difficulties involved or extremely expensive for you to make that reasonable accommodation for your employees. But if you think that that is a standard that you can meet, you are not required to make that reasonable accommodation. The next issue that pops up is Title VII. And so basically, same thing when we go back to the Pandemic Preparedness in the Workplace Act. They have the carve out for disability related exemptions. They also have one for sincerely held religious belief. So you must accommodate any employee that has a sincerely held religious belief against receiving a vaccine. This sincerely held religious belief must be religiously held. It must be religious in nature and not merely sincerely held. So for example, if I'm just extremely anti-vax, or I practice holistic medicine or something like that, those aren't going to be based in a religious belief. That's just a sincerely held belief against vaccinations. And so you can ask for documentation that this religious belief is sincerely held as well. Now, unlike the issue with a reasonable accommodation under a disability, this Title VII also allows you to deny or not have to make a reasonable accommodation if it creates an undue hardship. So if you look at the previous undue hardship test under the ADA, it has to be a substantial difficulty or extreme expense. Under the undue hardship test on Title VII, it just has to be more than a minimal burden or de minimis cost. So it's a much easier standard to meet to not have to require or to not have to make a reasonable accommodation under Title VII than it is under the ADA. So those are the two big hurdles that you have to get through. Is basically just, yes, we can mandate that a vaccine be taken by our employees. We can mandate that they be vaccinated. You just really have to make those two carve outs, and you have to make employees aware that those carve outs are available for disabilities or sincerely held religious beliefs. Then we look at OSHA. It's kind of a double-edged sword with OSHA. And the reason it's kind of a double-edged sword is that there's basically what they call the general duty clause under OSHA, which employers have a general duty to provide a safe and healthy workplace. Why it's a double-edged sword is not mandating vaccines, creating then an unsafe workplace. So if we don't require everybody to get vaccinated, but we require everybody to get back to work, have we then created an unsafe workplace? And if somebody does catch COVID and in the workplace, have we created an unsafe workplace? But then also, if we mandate vaccines for our employees, have we then created an unsafe workplace if an employee has a side effect? So it's kind of a double-edged sword. The Biden administration asked OSHA to come up with some guidelines related to COVID vaccines and COVID safety in the workplace. They were supposed to have done it by March 15th. They still haven't done it, so we'll expect future guidance. What I would say is OSHA has said that under OSHA, you can require mandatory vaccines, but unlike a sincerely held religious belief or an actual disability, if an employee has a reasonable belief that he or she has a medical condition, that creates a danger of serious illness or death. If they take the vaccine, they can refuse it. And again, even previous guidance under Osha says employers can vaccinate to, reduce the number of those at risk for infection in their workplace. Now, Osha itself is not mandating vaccines, but it is encouraging that all its Osha inspectors get vaccines so they can return to work and start conducting Osha audits and investigations. If any of you have any union employees, just be aware that there can be hidden things in collective bargaining agreements or under NLRA that would prevent you from doing things like this without the union approval. And then on top of that, just be aware of, under the NLRA, as an employer, you can't prevent concerted activities. So if you're going to put in a mandatory vaccine policy, and your employees are talking about it on Facebook or objecting to it or having their own conversations, you really can't take action against them for doing that. So they could say, I think my company is wrong and stupid for mandating us to have vaccines, and I can't believe they're doing this. It's against my rights. You really can't crack down on them for doing that. So you just need to be aware of that and be careful with that. And then obviously sometimes there are state and local laws. States generally have their own police power to enact laws for public health and safety. Some states have their own laws for vaccines and immunizations based upon industry. So depending on what kind of work you're in, what kind of business you're running, you could bump up against something where there's going to be a regulatory body or regulatory agency that is going to mandate vaccines. So healthcare, et cetera. You could come across things where, the Texas Department of Public Health is going to say that all healthcare workers or all people in long-term care facilities, et cetera, must be vaccinated against COVID moving forward. So just be aware of that. That would be an industry specific. It would be state specific, but then also based upon industry. The other thing is, schools, private schools, public schools, we don't know where that will go, if they will start mandating that COVID be part of the school immunizations. And then another thing, just local laws. Should we, knock on wood, hopefully it won't happen, but should we see another outbreak? There have been histories of localities making, so for example, I think there was like a borough, a small neighborhood in New York a few years ago that had a extreme measles outbreak, and they actually were mandating measles vaccines in that area in New York to try to prevent the spread because of how bad it had gotten. So again, that can just be something that could pop up, especially if you're a multi-state employer or something like that. If you are going to mandate it, could there be just potential, just general liability of being sued if you mandated that your employees get vaccines, especially if you did it on site? It just depends. I mean, could it be a workers' compensation claim? Possibly. If it occurs, if it's something that happens while they're at work, it will likely be compensable under workers' comp. Some states like California have also like an automatic presumption of COVID and vaccine issues automatically being a workers' comp issue. So yes, if you do the vaccine on site, even if it's voluntary, that could still be a workers' comp claim. If you mandate it, but it's done off-site, it may or may not be a workers' comp claim. And then same thing, if there were bad side effects, could one of your employees sue you? Possibly. And then the question is would, EPLI insurance or any sort of general business insurance cover or protect you against that litigation? There is one other thing that I'll mention. That if you are basically in the healthcare space, there is a rule called the Public Readiness and Emergency Preparedness Act. It's called the PrEP Act, which basically shields you from liability for providing vaccines, but you need prior authorization from the federal government to be eligible to have protection under that. And again, it normally only applies to medical professionals. The one thing I will say, which is kind of interesting, is they expanded they're expanding who is eligible to provide vaccines due to the public health emergency. So people that are eligible to give vaccines and protection under the PrEP Act they're not only just normal healthcare providers, but it's also people that are retired, but have retired within a certain number of years. it's medical students, it's actually veterinarians, midwives, et cetera. So there are lots of different interesting avenues moving forward for people to be provided with vaccines. Just to consider, if you are going to require or make vaccines be mandatory, if they're going to be mandatory vaccinations, first thing you need to figure out is how are they going to provide them? Are we going to do on-site things? Are we going to provide a near-site clinic? Are we just going to provide employees with information on going to find one and they have to bring us back, proof of their vaccine card? If you do on-site, which vaccine are you going to choose? I mean, obviously there's one that's just one shot, there's one that's 2 shots 3 weeks apart, and there's one that's 2 shots 4 weeks apart. So obviously, one of them, and then the efficacy changes. So one of them, you can get people, 80% protected today. The other one, it's going to take 4 weeks, but then they'll be 95% protected. So it's just a decision to make. How long would employees have to get them? Do you, luckily for the most part, especially in Texas, where we're past the eligible at different stages or phases, those kind of things, but still getting onto lists and those kind of things. So, what's the lead time for employees to get vaccinations? Who's going to monitor compliance with that? Unless you're, again, asking a whole lot of follow-up questions. If you're just asking for proof that somebody's been vaccinated, there should not be any HIPAA issues. They've already said that that's not going to be an issue. The issue would be if you're asking for proof from a medical provider, you would want to get authorization from that employee before you reach out to the medical provider. Or if you're asking follow-up questions, i.e. somebody saying, I'm not going to get one. Why? Well, I've got a medical condition. Okay, what's your medical condition? Those would just be things you need to be sensitive about. Make sure there's no HIPAA issues at play. And then same thing on those exemptions we've mentioned under either, OSHA or Title VII or the ADA. You should have a formal policy on hand that lays out how you will handle those exemptions and make sure you're documenting everything. So make sure you tell employees about the exemptions, make sure they understand how to file for an exemption, make sure you have a proper response to that request, and keep everything documented. Those of us in HR just know about documenting everything. And then just a few other things to think about if you're going to be requiring them. Employee morale would actually be a thing. We are it's trended downward. It used to be 1 in 3, but we're still, as of pretty much the end of March, 1 in 5 Americans have still stated they would not take a COVID vaccine. So you can see it's gone from basically about 30% in late November, December. Would say they probably wouldn't we're down to about 20%, so 1 in 5, but it's trending down a little bit, but still that's 1 in 5 of your employees are going to say, I'm not going to get it. So if you are going to require it, just make sure that you have a clear communication strategy, explain what the business necessity is, and educate employees on the exemption, and then just make sure you act in good faith with those exemption requests. If you, again, so that's just going to be if we're going to require it. Again, on the requirement, just, the pros on it, you're providing a safe workplace, which you have a generally to do under OSHA. You're protecting your high-risk employees. You're avoiding conflict on pro versus con vaccine because you're not making it voluntary and having people that are pro-vaccine saying, why don't you get it if you're not vaccine, et cetera. And then also, from a business standpoint, customer confidence of saying, hey, all our employees are vaccinated. It allows for a faster return to normal operations, et cetera. And then some of the cons, which we've talked about, are just possible side effects and what happens if there's side effects or injuries from a mandatory vaccine. We talked about employee morale, and then just the administrative burden of how are you organizing it? How are you tracking it? How are you handling the exemptions, et cetera? And so at the end of the day, what I would really say is most all governmental agencies, HR consultants, and the big major labor employment firms are saying the same thing, which is, yes, you can make vaccinations mandatory, but we would encourage you to recommend them, not require them. So that's kind of where the rubber meets the road. Yes, you can do it. most people recommend that you don't make them mandatory. So having said all that, what else are we talking about? I mean, with Texas opening up, vaccines allowed to be mandatory, vaccines available to everybody, what do we need to do when we're thinking about opening back up fully? The first thing is have a plan. So you should be thinking about an established return to work date for your workforce. If you still have a good chunk of your employees working from home, you should think about establishing a return to work date and notifying employees well in advance of this is our intended return to work date. Within that, just be prepared for individualized requests. I mean, there are going to be individual employees that are going to say, I'm still not comfortable, or I don't want to come back. Again, if you're only going to do recommended vaccines, I don't want to come back until I know everyone around me is vaccinated, or whatever. Just be prepared to handle those. Even if you do a blanket, everybody must come back to the office on this date. Be prepared for those individual requests from those people. And so then be prepared to make accommodations for them, and think about whether or not you're going to make accommodations for them. That's been a struggle with a lot of employers of, do we make this accommodation, or is this, hey, no, this is a job that has to be done in the office and we're willing to let you go, terminate your employment if you don't return to the office. So again, prioritizing what are your business necessities, who needs to be in the office, how has productivity been, and how have people's work products been while working from home, and do we really need to see them back in the office? And then also just team building. I mean, you've got a lot of people that have been home for 12 to 15 months by themselves, and even with daily Zoom calls, it's just not the same as being in the office with somebody. So think about activities or things you can do, gifts, even whatever, ordering Tiff's treats, something, to just welcome people back to the office and think about them getting back in that spirit of being in the office. I mean, if everybody had been home for 30 days and then we have to come back, I think that would be easy to adjust to. But people that have been working from home for 12 to 15 months, it's going to be a tough adjustment. Make sure you've got good disinfecting and cleaning measures. What are you going to do if somebody tests, just like we've been doing this whole time? Continue to think, what are we going to do if somebody tests positive? We're going to have more people back in the office. We're going to need more cleaning, et cetera. Most employers, even the ones that reopened, are still doing daily screenings. Think about that until, we're somewhere towards herd immunity. Make sure you're doing safety training. Keep putting up signs in the restroom about how to properly wash your hands. Continue to put up information about social distancing. Continue to put up things about, make sure you have hand sanitizer stations, et cetera. And then be prepared for mental health issues. And that's kind of twofold. One, again, you've got a lot of people that have been working from home for a long time, and they're just not ready to adjust to coming back into the office. And then the other thing, I don't know how many people saw it, but there was actually an article that came out yesterday that said they're already starting to see some people that had COVID are having issues, cognitive issues, mental health issues, anxiety, depression, et cetera, in people that had COVID. So also be prepared for the long-term effects of not only the people that have just been working from home, but your workforce that have tested positive throughout this pandemic. Just be aware of that. Make sure you've got a good mental health program. You've got the right resources for your employees should they have mental health issues pop up. A big one has been mask policies. Obviously, they're not required in Texas anymore. Just remember that they're still recommended by the CDC. And if you have employees that are starting to travel again for work, they are required for travel still on airlines, buses, trains, et cetera. So any sort of public transportation, they are still required. If you've got employees that are working in close distance, they would still be recommended in situations where good social distancing isn't possible. Be willing to provide them if necessary as we're going through this period where some people are vaccinated, some aren't, but we're trying to get people back in the office. Be willing to provide them if necessary. And just as a side note, the IRS did come out and say that they are qualified medical expenses now. So if you've got an FSA, an HSA, et cetera, you can get reimbursed for masks, gloves, hand sanitizer, et cetera, under your FSA or HSA. And then just, make sure boundaries are respected. If you've got somebody that's clearly doesn't want to wear a mask and you've got other employees that are still not comfortable being back in the office, just be cognizant of that and be respectful, and don't go walking up to somebody's cube. Stop a few feet away and say, hey, do you want me to take my mask off? Is it okay if I take it off? Do you want me to put it back on, et cetera? Don't just walk up on people and expect them to be okay with you, not wearing a mask, et cetera. And conversely, you want to make sure you're not teasing people or giving people a hard time that are uncomfortable and want to continue wearing a mask. So just good social boundaries, etiquette, et cetera. And then, on the social distancing side, just if possible, if you haven't done it yet, look at reorganizing your office layout, making sure people are 6 feet apart, 3 feet for schools if you're wearing a mask, and those kind of things. Just, in general, keep up with the CDC guidelines on social distancing. And then also, if you're going to be doing team meetings, office meetings, outings, et cetera, make sure that you're practicing social distancing. The other thing I would say on the mask policy too is if you've got people that are in kind of outside sales or out meeting clients, those kind of things, just be cognizant. They need to be aware of what the policies are of wherever they're going, and respect, obviously, the businesses that they're visiting. Again, so, just some general recommendations: social distancing, hand sanitizer stations, be aware just of side effects and injuries of vaccines. Make sure you're handling employee morale, and just I know this is kind of repetitive, but the administrative burden of all these people returning to work, you just really got to be ready for it, because it's going to be a bit of a headache if you haven't opened up fully yet. Just be prepared for some of the ups and downs that are going to come with that. With that, that's kind of all I really had. I know we kind of ran through that, but I just wanted to, kind of as quickly as possible, get through a lot of the high level things around returning to work, vaccines, et cetera. It is still a moving target, but hopefully, we'll be landing somewhere soon, getting somewhere close to herd immunity, and be somewhat back to normal sometime soon. I know we finished a little early. I thank everybody for attending, and thank you to the Chamber for having me. And if anybody has any questions, feel free to email me or anyone at the Chamber, and we'll be happy to respond to you.